All right, welcome to our broadcast. It's August 15th, 2023, and we're at Duke Spine Institute. We're performing spine surgery on a patient who is suffering with severe pain in his back for years. Shot. And he has degenerated discs. That's enough. At L2-3, did you put? No. Go ahead. L3-4, L4-5 with stenosis, which is narrowing of the nerves at L2-3, L3-4. Just leave the medicine here. Shot. Shot. My goal is to get into the discs that are bothering him, shot, and fix them. And the way we do that is we use a technique called the Duke laser disc repair. AP, and we're doing left 2, 3, 3, 4, 4, 5, correct?
Essentially the right side.
Sorry.
For the DPR?
So it's bilateral 2, 3, left 3, 4, left 4, 5.
Yes,
Shot. 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 AP. First step of this surgery is to gain access to all the discs we're fixing through a transforaminal approach using a needle. All right, stay there for a second. Shot. All right. Shot. Lateral. 12, 1, 2, 3. You can see 2, 3 is very degenerated. Shot. 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 How's he doing? Shot.
How you doing, my friend? You okay? Good. Can you open your eyes? Good. We're going to ask you some questions, okay?
Stay there.
All right.
Are you comfy?
Are you comfortable right now? He said yes.
Shot. Trying to get into 2, 3 on the right side. It's really challenging. Shot. That looks pretty good. All right, let's go south. Skin knife. Numbing. You got it? Now, since we're fixing 5 areas, we have to go on both sides at multiple discs. You're doing great. Hang in there. We're going to put you to sleep soon. We're going to make our incision here on the left because we're doing a left 2, 3, 3, 4, 4, 5. So far, I've accessed 2, 3, 3, 4. I have one more disc to access from the left side. That's 4, 5. So we're going to do that now. Shot. Shot. He's doing fantastic. He's been so helpful. Just laying still. Shot.
please. 18 right up.
Almost
Thank
there.
you.
Shot. Now, how long has this patient been suffering with his back pain? Shot. AP, 25 years. And where does he come from? That's right, Ohio. So, like many people, he found us on the internet and discovered that we were doing new treatments to basically cure back pain coming from various areas of the back. In his case, the discs, shot, and the facet joints. Beautiful. So once we've gained access to these discs, we have a very safe path that we can enter the disc. Because he has so many discs at different levels, we're going to have to attack these from different locations. Injection. I'm going to give him some more numbing medicine. Shot. Is that it there? Nice. So this is a 4-5 on the right, correct? Everyone agrees? So we've done a left 2, 3, 3, 4, 4, 5. We're doing a right 2, 3, 4, 5. Shot. 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 Almost there. Shot. AP. Next we're going to do our test with the discogram. We're almost ready. Looking good.
You okay?
We're ready for him.
All right, we're gonna just move this over a little bit here. Okay.
Are you comfortable?
You all right? You're doing great. Great patient.
When
We're
he-
asking you some questions.
When I asked him, where is your back pain? This is what he showed me. It's all in here. Severe pain in all these different locations. So I wanted to see, well, what discs are here and what's wrong on the MRI. And I saw the MRI had some herniated discs, degenerated discs. And I figured that's where his pain's coming from. Are you comfortable? All right. Little pressure. All right. Any pain? How bad is that on a scale of 1 to 10?
Give us a number. Give us a number 1 to 10.
How high did it go?
Which 7? 7.
Is that where you get your back pain?
Yes.
All right. So 7 over 10 concordant at 2, 3. Is it better?
Feeling better?
Leave it. Just leave it. Are you having any pain? How bad is that on a scale of 1 to 10? How high does it go?
What number? What's that? What'd you say? 5? What'd you say?
I heard 8.
8. I just heard 8.
Yeah. Is that where you typically get pain?
Yes.
All right. That's concordant 8 over 10, 3, 4. How bad is that on a scale of 1 to 10? What's the highest it goes?
So that was a 10.
10. All right, so we now know where his pain's coming from, the discs. Let's go with the guide wire. We're ready, Dr. Berndes. If you're ready to put him to sleep, we're ready for him to be asleep. Any questions from our audience? Feel free to ask questions during the surgery.
Yes, we have a question.
Fantastic.
We have a question from Oz.
Shot? Yes, Oz.
on YouTube.
Shot.
He says, Doctor, why,
Shot.
why would a surgeon call an acutely caused disc herniation degenerative disc disease? Wouldn't that imply chronic?
Well, so he's asking about degenerative disc disease and whether it's chronic. Yes, degenerative disc disease is chronic. Most people we operate on have chronic back pain. We don't do any surgery on people with back pain less than at least 3 to 6 weeks. So back pain more than 6 weeks is chronic pain. I'm not sure I understood the question, but I think I did. All right, we're entering into the L4-5 disc. Show us the sacrum so we can confirm our level. Shot. No, you need to move down, Jordan. That's the whole point of show me the sacrum. Very good. You can see the tear. We are now entering the tear. That's the painful part of the herniation. Go ahead. Shot. We're going to bring our tube down. Shot. And take the dilator out, fluoro out. All right. Very good. Everything good? He's not moving at all, so I'm very happy. Go ahead and do your thing. Do your other stuff. Let's go ahead and show everybody the video on how an annular tear will cause so much back pain. Grabbers. We are inside the disc. All right, welcome back. You can see how a herniated disc can cause so much pain. The reason is inflammation. And that inflammation happens to be in the back of the disc where there's a tear in the wall. And that tear is called the posterior annular tear. And it is the cause of all disc back pain or neck pain that comes from a herniated disc. It's always coming from the annular tear, specifically the one in the back of the disc. That's the only one we ever fix, and we're able to eliminate people's back pain, usually 100% from the discs that we're treating. Of course, if there's another disc we're not treating that has causing back pain, we won't be eliminating that pain. We only can eliminate back pain from discs we're treating that are causing back pain. So the most important thing is to figure out where somebody's back pain's coming from. And that's called diagnostics. If you make the right diagnosis, then you know the right treatment and you provide the right treatment, their pain goes away. The key to a successful treatment is not just a successful surgery, it's a successful diagnosis. You have to have both. Think of the treatment as being a car and the diagnosis as being the gasoline for the car or the electricity. Without the fuel source, there's no movement. The car is useless. Treatments are useless unless they have the right, you're treating the right thing that's causing pain. Most doctors have no clue what causes pain, so they're not going to treat the right structure. Man, this disc is really badly damaged. No, this is 4-5, I think. It's just shattered. It's in fragments, total fragments. Now this is where your nucleus looks like crab meat. Everyone talks about how herniated discs look like crab meat. This is what they're talking about, this stuff. Look at the granulation tissue on the edges there. You guys see that? Let me get a picture of that. One more up on the light. Click the light up. Light up. Oh my God. You're not doing it. It's important. That's too many clicks. One click, I said. One, not two. You guys got to learn how to do things in the operating room. There we go. All right. That's nice. Sanjay, any more questions?
No, doctor, I'm good.
You're good. How about the audience? Are they good?
Yes, we have a question from HBK on YouTube.
Uh-huh.
He says, hello.
Hello.
Before 6 weeks or before any surgical operation, are you gonna do any epidural steroid or facet joint injection?
All right, so this doctor is asking if I'm going to do epidural steroid or facet. The answer is no. There's no reason to. Come on. Epidural steroid injections never fix anything. They never fix back pain. They only make it better for a few weeks, maybe a month. And then the pain comes back. So there's no point in doing an epidural. It's not a definitive treatment. And facets, you have to do facets only when you have facet pain. If there's no facet pain, there's no reason to treat the facets. When I'm not sure if they have facet pain, I'll do a facet injection. But I'm sure he has facet pain, along with disc pain. So I've recommended the rhizotomy, which we're going to do later. Good questions.
Yes, we have another question from Oz on YouTube.
Thank you. Yes.
He says, Doctor, what discogenic etiology would not be surgical, even for your laser?
What discogenic pathology would not be surgery? There's no such thing as discogenic pathology that doesn't require surgery. If your pain is coming from a disc, the only way to eliminate that pain is through surgery. There's no other way. So if you want your patient to be in pain, then don't do surgery. If you want your patient to have the pain stopped and ended, cured, you have to do surgery. The best surgery for the disc pain is the Duke laser disc repair. This surgery here. There is no better surgery. This surgery is designed specifically to go and eliminate discogenic pain. There's no other purpose of the surgery. There's no decompression. I mean, you can decompress with the surgery, but the purpose of the surgery, the annular debridement, is to eliminate the source of discogenic pain, which is the herniated nucleus within the annular tear, the scar tissue, the granulation tissue, basically the source of inflammation, which is the interposed nuclear herniation. There are other treatments for discogenic pain that are surgical. Another option would be fusion. And another option would be artificial disc, total disc replacement. Those are the only treatments that I would ever consider for discogenic pain. There's no other treatment that's appropriate at this time. Maybe in the future there'll be something else, but discogenic pain, definitive treatment is surgery. Without surgery, there is no definitive treatment of discogenic pain. It always comes back without proper treatment. Good job, Sanjay.
Thank you, doctor. We have a follow-up question from HBK on YouTube.
Okay.
Are you in the annulus or nucleus pulposus?
I'm in the annulus. The question is, am I in the annulus or nucleus pulposus? We are inside the annular tear. Remember, the annulus is 20 layers of collagen. The annulus is 20 millimeters wide, and we are inside the annulus. We're specifically inside the tear and the herniation. You can see the herniation all around. That's what I'm removing here. You see the granulation tissue? Almost done with this disc. This is the tear. This is the posterolateral part of the tear to the side. You still have to clean this. If you don't clean it, then they'll continue to have a lateral disc herniation in the foramen. You don't want that. You have to remove it. The blue is the herniation. The white is the scar tissue or tear. Almost done. This is the end of the tear. You can see the pink tissue is granulation. That's where all the painful nerve fibers are. Somatic afferent fibers from the sinovertebral nerve. They're bringing all the pain from this inflammation up to the brain, specifically to the parietal lobe, and in the parietal lobe, the primary somatosensory cortex, where you have highly localized sensations like pain. Very bad damage to this disc, very bad. But we're cleaning it. Remember, never try to get 100% because you'll never get 100%. If you do, you'll hurt the patient in the process. You don't need 100% of the herniation. You need around 50% or better, a little bit better. If you try to get 100, you're going to make an accident, a complication. Okay, that's the end of the disc. You can see the epidural space. Here's some scar tissue, calcium. What'd you find out about first assist?
I just need to submit my diploma and request that stamp.
You gonna do it?
Yeah, I can do it.
I told you I would pay for it, okay? Just about done. Remember, this is the left L4-5. We still have the 3-4 and the 2-3. This disc is degenerated, but it's not as degenerated as L2-3. L2-3 is horrible. Very bad. You see how the laser vaporizes the tissue? It literally breaks it into small pieces and it disappears. It comes out through the irrigation. 1 minute. Let's see. The facet joint will be right there. You see the facet joint? That's literally on the facet joint. That's a bone spur on the facet joint. It's pretty cool. The relationship of the disc, the facet, and the foramen. Done. Done. Let's see the nerve root. The nerve root will be there in the fat. See how small the hole is? It's 3 millimeters. Always 3 millimeters when we're finished. It should heal very quickly. Scope off. What is it? You're going to change irrigation? Go ahead. This is the time to do it. Any questions, Sanjay?
Yes, we have a follow-up question from HPK on YouTube. He says, is this annuloplasty or sinovertebral nerve ablation?
This is an annular debridement. It's not an annuloplasty. You're watching the Duke laser disc repair. We created this surgery. Can somebody pull up my my lead? My lead. My skirt is falling down. It's literally about to fall down. Yes. I should have had bigger lunch. I think that's good. No, that's good. Thank you. The surgery you're watching is not something anyone else has done. It is created at Duke Spine. We call it annular debridement. All right, shot. We've been doing it 16 years here. 17 years now. Thank you. You got to show the nurses how to do that. Shot. All right. Luis, I need help. You're supposed to be holding the blue. Mm-hmm. You're watching Duke laser disc repair. We made this surgery here. We pioneered it. For 17 years, we've been doing this surgery. Shot. Shot. All right, out. Grabber? Any questions, Sanjay? Another shattered disc.
Yes, doctor. We have a question from Oz on YouTube. He says, Doctor, do you believe corpectomies are medically necessary?
Corpectomies are medically necessary? Very rarely. Very rarely. If you're talking about a cervical corpectomy or a thoracic or a lumbar, it depends on the situation. But cervical corpectomy is almost never needed. Lumbar corpectomy is for severe trauma or infection or tumor, but very rare. So for the most part, they're not needed. Depends on the situation. I've done many corpectomies in my career. In the cervical spine, you do corpectomy if the herniation or stenosis is behind the vertebral body. If you have a hematoma, a herniated disc that's migrated behind the body, if you have OPLL, if you have a tumor behind the vertebral body, you have to do corpectomy. But for degenerative disease, no, it's not needed. It's not needed unless you have literally stenosis behind the body. So, for lumbar, you do corpectomy when there's tumor, trauma, fracture, and you're trying to reconstruct the spine. If you have a fractured vertebral body, not weight bearing, you need structural integrity of the anterior and middle column. You do a corpectomy, you reconstruct it with a cage or a inner body column. They're just called cages, but they act as a column. My God, this disc is just destroyed. This is all very old injury. Old injury to the disc.
Please, can I have more Raytech, please? Raytech, please. Thank you.
Grabber. To me, this injury to this disc looks like some type of significant trauma. A lot of energy transmitted to the disc, causing the disc to just fracture into so many pieces. Falling off of a roof or a ladder, serious car accident. But all that energy from the accident is transmitted to the nucleus, causing it to shatter. And you see all those pieces, right? Every one of those could herniate out of the annulus into the epidural space.
It's probably cool.
That's why I want to remove as much as I can. Any more questions?
Yes, we have a question from HPK on YouTube.
Okay.
Are you doing bilateral for this procedure for some of the discs?
Yes, I'm doing bilateral for some of the discs because The reason you do bilateral is not for back pain. You do bilateral for leg symptoms. This patient has bilateral leg symptoms. So he's got bilateral radiculopathy or bilateral stenosis. So I need to treat both sides. If you look at his MRI, he has bilateral lateral recess stenosis. At 2-3 and at 4-5. 3-4 is not too bad, just most on the left, which is why we're doing the left side. Man, this disc is just so destroyed, huh? You guys see there's no preservation of normal disc. It's just, everything is fractured and fragmented. A lot of people, you can't see this, by the way, on the MRI. The MRI will never show you this. At least not in 2023. Maybe in the future, the MRIs will show you the extent of injury. And surgeons have described this as, I have to remember the term. There's a term for it, it's eluding me. Do you remember, Luis? Internal disc disruption. That's the name that doctors have given it over the years. Internal disc disruption. It means the disc internally is damaged severely. And you don't see it on the MRI. It's usually associated with a bulging disc rather than a huge herniation. And the implication with internal disc disruption is that whatever caused the trauma destroyed the inside of the disc, like this one. This is a perfect example. It caused massive fragmentation of the nucleus and fracturing, which then evoked over time scar tissue from inflammation. Internal disc disruption, that's what this patient has. Just another 2 minutes on this disc, then we're going to move to the next one.
We have a question from Oz on YouTube.
Sure.
Do you think 3T MRI is better for disc herniation as opposed to 1.53T?
That's a great question. I do not. I think that there's lots of patients who have 3T and the radiologist reads the MRI incorrectly. What matters is you have a good radiologist, a good read to make the diagnosis. So many radiologists miss the smaller herniations. They call it normal, but it's not normal. And it's not because of the quality of the MRI. It really is just a lack of consistency among radiologists and reporting findings. It turns out the small herniations can be the most painful. The symptoms from a herniation have nothing to do with their size. It has more to do with their physiological activity. Are they creating inflammation or not? This is what we discovered at Duke Spine Institute. Nobody else has ever discovered this. All right, almost done. A little bit of epidural fat. We're at the back of the disc where the back of the tear is. I'm just debriding the last of the annular tear and herniation. You can see the fibers of the posterior longitudinal ligament there. I'm just underneath the PLL fibers, removing the rest of the herniation within the tear. I want this tear to heal. The body will heal it. If I clean out the herniation, the body will heal the tear. This is lateral again. I remind you, if you're going to do these surgeries, always look laterally. Do not finish until you've looked laterally, because there's always a lateral component of the herniation. And if you forget to take it away, the patient will still have that. All right, and they'll be susceptible to having another herniation easily. Looking good. Look at that blood vessel. No, I'm done here. Look at the vein, guys. You see that? That's called Batson's plexus. And there should be a nerve root up there. Let's clean a little bit more, huh?
That's the plexus that actually carries cancer.
Yeah.
Cancer, prostate cancer in the back of the spine.
Yep. We're not going to talk about that. We don't want to jinx him. But you're correct. Between you and me. All right, looking good. And again, the facet joint will be right up there.
Maybe a lot of anesthesiologists don't know that.
Huh?
Maybe a lot of anesthesiologists listening don't know that difference.
Yeah. Any questions? Go ahead, Jordan.
No current questions.
I'll need a skin knife. None. Watch your hand. I got it.
We have a question from Oz
Shot.
on YouTube.
Okay.
What body positioning puts discs at higher risk for herniation?
What body positioning works best when someone's at high risk for herniation?
Yes.
I don't know. I really don't. I don't have an answer for you, Oz. I mean, you can't just stay in one position the rest of your life. I'm not sure what you're asking. That probably injected around the nerve root. Shot. We got a little trick we do when the disc is super degenerated. Take it out. We do I'll get into it with one side shot, and then we'll see how it's opening, and then I'll bring in the needle on the other side, because I couldn't really get the other needle in very well. Let me see. Yeah, now it's going in easy. Yeah. Just, it's about being an opportunist, you know. When you have the opportunity, you take it. This is a really degenerated disc. Much more collapse than the others. You could see it on the X-ray.
Kissing lips.
Shot. Nice. Beautiful. Good job. So I'm sorry I don't have a better answer about which position is best. But I do know that sitting with a herniated disc, it puts a lot of pressure on the disc. So you probably don't want to sit. Can I get a pull up on my skirt? Thanks. Sorry about that. Grab her. Feels like it's about to fall again. Ah. Yeah, it's nice. Thank you. For those of you wondering why am I wearing a skirt, basically, David Bowie inspired me. I'm just kidding. We wear, oh, look at that herniation. Show it to them. Look at this. Sanjay, you see this? Come on, light on. Sanjay, talk.
Lights on, please.
You see this?
Yes, doctor.
Okay. You have a nice picture of the herniation?
Yes, we do.
All right, very good.
Thank you.
I'm not good at reading minds. Well, what I was saying is when you do spine surgery, orthopedic surgery, you're using the x-ray a lot in the operating room, and you have this special kind of lead that it actually comes in two parts, a skirt and a shirt. And so I like this two-part lead. It puts less weight on your shoulder. Oh, there's another piece. Grab her. So at the end of the day, your shoulders aren't too tired. It puts some of the weight on your waist. Well, the waist part is called a skirt. So it is what it is. Oh, yeah. So this disc is far more degenerated. You see that? There's not much nucleus left. There's really no nucleus left. It's all just annulus and scar tissue right here. All the nuclear material is gone. It's a piece of herniation crawling out of the depths saying, oh, please, stop hurting me. I'll come willingly, you know? The nice thing is that herniated discs, they don't have rights. Right? I can beat them up with my laser and my grabbers. We can make fun of them. They can't sue me. Now, Luis, you guys see what's happening in Los Angeles? All these people running in the stores and stealing everything, handbags, and going into like Gucci, and like 30 people and just smash and grab and just leaving with $1 million worth of stuff. It's pigs. Absolute disgusting. They don't want to blame us like it's our fault. There was a time when I had no money to my name. I didn't go out and steal. I earned it. Or I went hungry. It's that simple. And these people try to justify their behavior and they say it's okay. It's not okay. It's absolutely never okay to steal from another person or harm another person. So it's very upsetting to see Los Angeles, my own city that I came from. So much crime. Every day now. Businesses are leaving LA. They don't want to be there anymore. I don't blame them. These thugs are coming and stealing everything. All right. We're just outside the disc. See, that was a lot easier, right? Because that disc, L2-3, was so badly damaged that there's no herniations left. There's just a little bit, and we got rid of it. Any questions?
Yes, we have a question from Oz on YouTube.
Yep.
He says,
Sure.
Doctor, I once read a deposition transcript of an insurance hired surgeon who testified that a sneeze can cause a herniated disc more than a minor impact accident. What do you think about that?
A sneeze caused a herniated disc more than a minor impact accident. I need
Yes.
a dilator. I need to push this down. Absolutely not. It's not true. There's a lot of misinformation out there, folks. Don't believe everything you hear. Okay? The only way to get a herniated disc is with an annular tear. You must tear the disc. The wall of the disc must be torn before there's a herniation. And sneezing will never tear the wall of the disc. Never. Not in 1,000 years. It must be trauma. Now, the trauma may be a long time ago and they may not have had any pain. But it's always trauma that causes the herniation. Always. Shot? That's like, I have to be careful what I say. It's the same as somebody becomes pregnant and you say it's not possible without insemination. And they say, nope, never done anything. Okay. It's impossible to have a herniated disc without trauma. There must be a history of trauma. It could be a sports trauma. It could be accident, could be slip and fall. It could even be birth trauma when you were born from your mother's womb. The surgeon was pulling hard, or the doctor was pulling hard in a C-section or vaginal delivery. It doesn't matter. In the end, it's always 100% trauma related. This is another one of those discs that's very damaged internally. I need someone to pull my skirt up one more time. I just don't understand how I could have not tightened it enough. Is the belt snapped on the right side? Yeah, go a little higher. You did really good. Just a little bit higher. Thank you. That's perfect. Sorry. You're getting your workout in. All right. I need the camera. I need the monitor on. Show her. Show her. Let her do it. She's never going to learn unless you teach her. I need the scope on. How's our irrigation, guys? All right. Sanjay, any more questions?
Yes, we have a question from JMC on YouTube. He says, what is a psoriatic spondylitis?
Psoriatic spondylitis is when you have psoriasis and you have inflammation in the disc as a result of psoriasis. And the disc will collapse. It'll look like an arthritis joint. Remember, psoriasis is a immunological disease, autoimmune. They call it autoimmune, where they think the immune system attacks your own body. Well, it attacks not just the skin, the dermis, but also the joints.
It's the most diet sensitive of all the autoimmune disorders.
Yeah, I didn't know that. Dr. Berndes adds that if you control your diet, it can be very helpful. Thank you, Dr. Berndes. Great questions from our audience.
We have a question coming from Oz on YouTube.
All right, Oz, let's hear it.
What diagnosis is more severe?
Too fast, too fast.
Radiculopathy? Oh. What diagnosis is more severe? Radiculopathy or radiculitis?
That's a good question. Radiculopathy is more severe. Radiculopathy means dysfunction of the nerve root, and radiculitis is inflammation of the nerve root. Inflammation of the nerve root is very common, and it happens from most likely herniated disc with chemical irritation. It's much more common than radiculopathy. But radiculopathy is more serious because with radiculopathy there's damage to the nerve root, usually from either severe inflammation or from compression. Something pinching the nerve, damaging it. Great question, by the way. It's the first time I've heard that one. All these years of doing this. Radiculitis is really inflammation and irritation of the nerve root. Radiculitis causes sciatica, leg pain, or if it happens in the neck, arm pain. Radiculopathy is more of a nerve damage. Definitely more serious.
From long-term radiculitis.
Yeah, it could be from long-term radiculitis. That is correct. Or it could be from pressure. Uh-huh. Yes, yes, do it. You don't need to ask me. Just do it. I'm never going to say no. You just need to let me know you're doing it. That's all. Thank you. Good job, ladies. Grab her. All right, Sanjay, any more questions?
Yes, we have a next question coming from Sherry on Facebook.
Oh, Sherry.
Can a ruptured disc come from repetitive lifting and bending, like a factory work?
Yes. A ruptured disc can come from repetitive lifting and bending. Manufacturing work, absolutely. That's trauma, right? For sure. Of course, it will have to be, lifting and bending with a load, heavy load. Not just like yoga, lifting and bending. There has to be a weight, a resistance, mass. All right. I've got 2 minutes on this disc. 5 minutes on this disc, and then we're going to move to the last disc. Is our next patient here and ready? Yeah. All right. Remember, we're going to do the DPR for facet pain as well.
We have a question from Oz on YouTube.
Yes.
So would you say radiculopathy is the evolution of radiculitis?
Yes, I think radiculopathy can be the evolution of radiculitis, but it can also be without radiculitis, just from pressure on the nerve. So remember, radiculitis is inflammation of the nerve root, usually from a herniated disc or from the facet joint, either of which are inflamed. And the inflammatory mediators are leaking out onto the nerve root next to them. Because remember, the nerve root passes right past the back of the disc where the tear is. Okay, we see that all the time. And it also passes, the nerve root passes in front of the facet joint. And if the facet joint has inflammation from facet joint arthritis, that inflammation will leak onto the nerve root as the root passes in front of the facet, and there's a tear in the capsule. And the facet capsule will leak inflammatory stuff onto the nerve root. So the nerve root gets radiculitis either from disc inflammation or facet or both. But radiculopathy is damage to the nerve. This can come from long-standing radiculitis that causes eventually damage, or it can come from pressure on the nerve, which is less likely, by the way, from stenosis. Both are possible. Now, I've seen people with radiculitis with nerve damage too. Even though the herniation is small and there's no direct pressure on the nerve root, they still have radiculopathy and radiculitis both. So the radiculitis can definitely cause radiculopathy over time if it's severe enough. That's why they call radiculopathy nerve root dysfunction, meaning the nerve root's not working properly. And there's many reasons for dysfunction. One of them is compression damage. The other is inflammatory damage. That's why people with sciatica get better with the epidural steroid injection. You're reducing the radiculitis. You're not reducing the radiculopathy. Sanjay, you learning?
Yes, I'm learning, doctor.
Good. All right, here's the end of the disc. Now we're in the epidural space in the foramen. Yeah, 2 minutes on this one, and we got one more to go. I've cleaned out all the herniation. This tear will heal itself in time. Now the patient can heal it. Before, the patient could not heal it because the herniation was stuck in the tear, blocking the healing. Now we've gotten rid of the herniation, so the tear will heal. Let me have a grabber. By the way, for those of you who don't know, the laser fiber, that is 1 millimeter across, 1 millimeter wide. It looks big, but it's not. It's only 1 millimeter. So that gives you an idea of the size of these instruments. This grabber, the shaft, is probably 3 millimeters. You see the metal shaft down there? It's 3 millimeters. Very skinny. But the glass here, the glass fiber, is 1 millimeter. And the inside of the tube is about 5.5 millimeters. All done. The nerve should be over here, there. It's in the fat. All right, that's good. Very good. Done. One more. We're starting to hit our stride. Right, Luis? You guys know what stride is? When you're running, you find the stride. The stride is how far apart your legs and feet are every time you take a step. And the wider apart they are, the more energy you expend, the harder it is. So you have to find your stride, which is the perfect distance for each step that you're not spending too much energy, but you're making very good progress. All right, last one. Let's get the fluoro in. Who pulled up my skirt last time? Your hands are magical. I'm so embarrassed. I feel like I need suspenders. Thank you. Yeah, it's perfect. Sorry about that. Okay, last one. Any questions? Shot?
No current questions.
Shot? Uh-huh. Nice. Shot? Look at that. Guide wire. Beautiful. This will be our last incision. Shot? Very nice. Almost done, doctor. He's doing so well. I'm so happy for him. He and his family came from so far away to get fixed, and I hope this works for him. I think it will. I'm going to be very surprised if it does not. Shot? 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 Take it out. Oh yeah. That was a little more. Man, that disc is so collapsed and scarred down. The bones don't want to open. We're going to get in there and clean out this side. Luis, I haven't hit your hand yet today. I'm doing pretty good, wouldn't you say? That's it. Sorry. All right, after this last one, we're going to do the DPR for his facets. Luis, remind me, I got to talk to Matt and get us some new cervical shafts.
With the butterfly.
Mm-hmm. Yeah. It's becoming more and more obvious with these degenerated discs, you know? Why don't you work on those other two incisions, you think?
I can, yes.
Here. Just put that down there. And go ahead and work on those. Give him some light to Luis. Any questions? Laser on.
No current questions.
We're going to do the right side, correct?
Yes, sir.
How's my irrigation? Good? All right, thanks. You just do your thing. You guys are doing great. We're almost done. I've got about 1.5 minutes, 2 minutes on this one, and then we're going to move to the DPR. Oh yeah, look at that. You guys see that herniated disc right there? Look how scarred up it is. It's got some blood vessel, like little blood vessels on it. You see the pink? That's a really nice piece of basically bone spur scar tissue from arthritis going on inside this joint. There it is, the grapes of wrath, I call them. Anybody read the grapes of wrath? John Steinbeck? Huh? Look at the grapes hanging there from the ceiling. That's where all of his pain's coming from, right there. That is beautiful. You see this, Sanjay? When we talk about inflammatory tissue, granulation tissue, that's like a giant zit in the back of his disc.
Yes, we do.
Get rid of that, you get rid of the pain. It is the nidus, the pain generator. It's Medusa. Okay? It is Medusa with the snakes on her head. Instead of snakes, she has blood vessels. And she's very painful if you don't know how to handle her. And she gets into this labyrinth of the disc for years, wreaks havoc, pain and suffering for people. And she lives in this labyrinth. And who killed Medusa? Is Henry there?
Yes, I am.
Who killed Medusa?
Percy?
Yes,
Yeah.
I believe it was, right? Let's verify that. Anyway, we are either Jason and the Argonauts or Percy. That's who we are. We're here to slay Medusa's ugly head. It's causing all the suffering for this patient.
Yeah, it was Percy, yes.
Beautiful. All right, we're done. Arthritis. Next, we're going to bring the fluoro in, and we're going to do the DPR. Correct, everybody? I need 30 seconds left. Grab her. Any questions from our audience?
No current questions.
All right, this is giving me a little bit of a fit here. Beautiful. If you want to know what we're doing, we call it debulking. It's debridement and debulking. The debulking is part of the debridement. All right, we're all done.
Nice one, please. Thank you.
Hoo-ha. Great job, team. Let's get the last thing done, which is going to be the DPR. Let's get that fluoro in.
We have a question from HPK on YouTube.
All right.
Do you know at which age Anthony Young retired?
At what age Anthony Young retired? I would say 82, if I had to guess. I don't know 100%, but I think he's 83 or 84 now. Anthony Young, for those of you who don't know, is one of my mentors, Dr. Anthony Young. All right, 5, 4, 3, 2, 1. Let's go north a bit. We said, what do we say, 1, 2 or 2, 3? 1, 2. Ah, no 1, 2, or it is 1, 2, yes. Yeah, I think he retired at around 81 or 82 years of age. Shot? 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 It's perfect. Do it. knife. I'm going to move it a little south. I know Dr. Young is still active. I talk to him from time to time. He's traveling to China now, and he's working, because he is Chinese, of course, he's working with the Chinese to develop products. Shot? 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 Shot?
Has he ever been here to visit you, Dr. Duke?
Dr. Young has never been here, no. But I visited him many times. Yeah. Shot?
Can you remove the lights on the camera, please?
Shot? That's perfect.
This cool, right?
Two down. So that was 1, 2. We got 3 and 4, right? Jordan, I need to see the next ones. I think I see it right there. I got it. Yeah, it's just faint. Shot. Too low. Shot. That's too medial. Shot. That's just about perfect, but a little bit too inferior. Shot. Too inferior. There we go. Num num. Go ahead. Great questions today. So, shot. We have am I too low, right?
Yes, sir.
5, 4, 3. Yeah, I see it there. Shot. Still a little low, but I feel the bone.
Yeah, thank you. 4x4. Stereo? Yeah.
Perfect. Shot. Feels perfect there. Shot. Gosh, it's perfect. All right, just about done. 30 seconds, maybe a minute. And we're going down to 4, right? 1, 2, 2, 3, 3, 4. All right, we're done. Great job, everyone. Great job, Luis. Great job, everybody. Thank you so much. You guys are awesome. Thanks for all the skirt pulling ups. I'll try to have my skirt on better next time. All right, Sanjay, you can end the broadcast.
We do have a few questions.
Okay, then keep it going and run a commercial or what do you call it? A testimonial. And I'll be there in a few minutes.
Yes, doctor.
All right.
Good morning. I'm Dr. Duke Majan at the Duke Spine Institute here in Melbourne, Florida, with one of my patients who traveled from California. He's been suffering with his lower back pain for years and found us on the internet and decided to come here and have the endoscopic Duke laser disc repair. We performed that 12 hours ago. And here you are, ready to go back to California, it looks like. How do you feel?
I feel great. It took a long time to get to you. Surgery was quick and painless. I don't remember a thing. Your staff was wonderful, but I am pain-free.
That's awesome. Yeah, and you're going to stay pain-free. We don't have you on any pain meds. We don't have you on narcotics, killing your pain. We didn't put any medicine in your back to stop your pain, so what you have is natural. And do you feel that pain anymore that you had before you came here?
No, the pain is completely gone. In fact, I quit taking my own pain pills 2 or 3 days before I got here. And I am on no pain pills at all, and I feel wonderful. When I woke up this morning, it was a different day. And I feel great.
And I feel wonderful for you for doing that. That's why we do what we do. We can cure pain, and we want everyone to know that, because nobody should have to live with pain every day. How does pain affect your life every day?
Pain is traumatic. The kind of back pain that I was suffering put me in bed. And for the last 3 months, I have been absolutely useless. Absolutely useless. And so I found you. It took me a few months to get here, and it was worth the trip.
It will be for the rest of your life.
Absolutely.
Worth the trip. Pain robs us of our dignity, doesn't it?
It does. It absolutely does.
And your parents are here, and they're very supportive. And that, to me, is so important, that you have people that understand what you're going through. I'm sure your parents have been a big support for you.
Oh, absolutely. Yeah, I was at work, a short story. I was at work last Wednesday dealing with this pain, and my back finally gave out to where I literally could not walk anymore. And I was 600 miles from home. And so I called my mother and father. They flew to San Diego and arranged the trip to get here. I called your place. I was scheduled for February 2nd, and I asked Richard on the phone if he could get me in sooner, because I was desperate. And you guys got me in a week or two sooner, got me in the 24th, which was yesterday. And so we made the arrangements, and I flew here, stayed in the hotel for a couple days, and was operated on yesterday. And yeah, it's well worth the trip. I apologize for getting emotional, but it's been a long trip to get here.
Well, we want you to get emotional, because it is an emotional thing. When you've been burdened with this pain for so long, and then suddenly it's gone, and you realize that life can be lived without that pain, you know, and that you can actually have a life without the pain.
Yeah.
So what are you going to do now that you don't have the back pain anymore?
Well, I'm going to get my life back together. I've got a new job, and they've saved it for me. My boss is wonderful, and I'm going to go back to work tomorrow, actually, if you can believe that.
Yeah.
And I'm going to start riding my bicycle again and getting healthy again.
Well, your surgery went very well. I don't know if you've watched it yet, but we were able to get in with a tiny 7mm 1/4" incision and fix both painful discs, and they were both very painful for you. And the pain was coming from a small tear that's located in the back of your disc where your herniation came out of. And that tear was just so inflamed, and we were able to clean out the herniation that was stuck in your tear and use the laser to debride it. And that's what the Duke laser disc repair is. It's a debridement of the annular tear to eliminate back pain and leg symptoms. So we also have a cyst. We didn't treat your cyst. And do you think the cyst is causing any problems for you?
At this point, no. I don't think so, because all of my symptoms are gone. This morning when I woke up, I was a little nervous about getting out of bed. But that subsided quickly when I stood up and could stand up completely erect with no pain or bindage feeling in my back.
Yes, when I walked in and saw him this morning for the first time, the first thing your mother said was, "Look how straight he's standing." So they must have watched you suffer for a long time.
Oh yeah. Yeah, my mom's a great lady. I'm blessed to have her in my life. And then that's my stepfather, Jerry. He's a wonderful man. He and I are pilots. We fly together. We do a lot of things. And he's seen me go downhill. He knew something was wrong, you know.
How did you find out about us?
I've been seeing a chiropractor in Sacramento for 35 years. And 2 months ago, I started to really feel bad. And I would go to him. And after about a month of going to him, and going to my doctor for some pain management for these symptoms, I finally figured out that something else was wrong with me. And so I asked the chiropractor, what can we do? Because what you're doing is not helping me. My doctor put me on pain meds, and they took some of the sharp pain away, but nothing was helping. And so, being kind of a mechanical engineer, I decided to look into how my back was put together. And I requested an MRI from my doctor and from my chiropractor. And so that took 3 weeks to schedule. That's a long story. And I finally got an MRI, and I looked at it myself and realized that I had a cyst of some sort and that I had some problems with my lower discs. And that's when my chiropractor told me about you. He said, get on the internet and do some research and then call these people. So I called your store. They gave me some information. I FedExed my package to you guys, and a week later you called me. And about a week or two later, I got here.
Wonderful.
So, yeah.
And here you are pain-free for the first time in many years.
Many years, many years.
Congratulations.
Yeah. Thank you.
Is there anything you want to say to your fans out there?
There is. This is a miracle. In Sacramento, everybody that I know said, why are you going? Why are you going to Florida? Why don't you find somebody in Sacramento? And I said, well, because I was referred to Dr. Duke Majan, and I've done a bunch of research on him, and I just have a great feeling about him. Not only that, he personally called me on the telephone because I told his people that I had some questions, and that's what sealed the deal. And so it took a while to get here, but it was worth everything. And I would recommend anybody send your MRI to this guy, and if he can help you, he will. Okay? Thank you, Doc.
You're welcome, sir. It's my pleasure.
Yeah, absolutely.
All right, go enjoy the rest of your
All
life.
right, thank you.
Oh, I hope you enjoyed the testimonial there from one of our patients who underwent the Duke laser disc repair. We've just completed 5 levels. We did bilateral 2-3, we did left 3-4, and bilateral 4-5, and then we went on to do the facet joints. So just so people understand what was being done today, this patient had back pain coming from discs that were damaged. The best treatment for this is to go in with a laser and repair the discs. It's called the Duke laser disc repair. We go transforaminally through the hole here. I did that on both sides for 2 discs, and then on the left side for the other. And in addition to that, we also killed the pain nerves to the facet joints, which were causing pain for him. He did very well. We had no complications. The surgery went very smooth. But you could see if you go back and watch the video that some of the discs that we had to fix, they had good height, they had good substance, but the substance was damaged terribly, and you wouldn't know that based on the MRI scan. This phenomenon is called internal disc disruption, and it was first described by pathologists that would dissect human bodies after they were dead, of course, and they would look at their discs and say, wow, look at this disc, it's so fragmented, it's internally disrupted. On the outside, the disc looked relatively normal. However, inside, once they sliced it open, they got all these chunks of disc material. And so they realized that something had happened to the disc in that patient's lifetime, and that something, of course, is trauma. Something smashed the disc without actually completely blowing it out. And of course, there's still a tear within the annulus, and over time, inflammation and pain. And that's what this patient had. He had many years of inflammation and pain. So I think that's all going to be gone with this surgery. All right, our questions.
We have a question from JMC on YouTube. Is an epidural steroid injection or transforaminal injection better for arm pain?
So somebody is asking, is epidural steroid injection or transforaminal steroid injection better for arm pain? The best treatment for arm pain is to, number 1, figure out what's causing it. Why does somebody have arm pain? Is it a pinched nerve or irritated nerve root in the cervical spine, or is there something else going on? For example, you could have a pinched nerve in your elbow causing pain in the arm. You could also have tennis elbow, bursitis, which would be tender right here, and that would cause arm pain. So there are many causes of arm pain. There's also anterior interosseous syndrome, posterior interosseous syndrome, where you get traps of nerves. Those are usually motor deficits rather than pain. But long story short, you got to make the right diagnosis. So let's assume for a moment you're saying there is a pinched nerve in the neck. What's better, transforaminal or interlaminar epidural? It doesn't matter. They're both bad. What you really want is you want a definitive treatment for the patient. You want the Duke laser disc repair. That's the only way you're going to get rid of that pain, or do a fusion. A fusion would also work as long as it was done well.
Next question comes from HBK, once more on YouTube, and they ask, is this RF cannula? I don't know what that means.
Is this a radiofrequency cannula? No, it's not. No, Duke plasma rhizotomy is a novel new treatment. You've never seen it before. We're the first to do it in the world. That is not an RF cannula.
We have a question from HBK again on YouTube. For facet joint pain, any necessary doing again this procedure after a while?
The Duke plasma rhizotomy is permanent. You do not need to redo it again. It will last 50 years, 100 years, however long the patient lives. It is a permanent cutting of the nerve to the facet joint. It's the medial branch of the dorsal ramus, and rather than just trying to burn it with a probe, we are literally burning it and cutting it. So it's far more effective with the Duke plasma rhizotomy.
Another question from HBK. During surgery, are you wearing lead apron?
Yes. I am wearing a lead apron during surgery. All of my staff that are close to the body are wearing lead. I wear a lead apron and a lead vest. So vest and apron. We call it a skirt.
That's it.
All right, great questions today. I hope you enjoyed. We have another surgery coming up in a few minutes. It's a bilateral L4-5 and one side L3-4 Duke laser disc repair. We'll also be doing the Duke plasma rhizotomy. I forgot which side it is, but for facet pain. And then we have one more surgery at the end, which is a 2-level Duke laser disc repair. Come back and see it in a few minutes. Thank you.